At this time, I would like to introduce the Interim Dean of the School of Health Management, Dr. Donald Altman.
Thank you, Dr. Gevitz. It is now my honor and privilege to introduce this year's commencement speaker, Dr. Janice Probst. Dr. Jan Probst is a professor in the Department of Health Services Policy and Management, Arnold School of Public Health, University of South Carolina, where she leads the federally funded South Carolina Rural Health Research Center. Dr. Probst received her undergraduate degree at Duke University and her graduate trainings at Purdue University and the University of South Carolina. An experienced teacher as well as researcher, Dr. Probst has received faculty awards for excellence in both teaching and research at the Arnold School of Public Health. In 2008, she was named a National Rural Health Association Outstanding Researcher for her work in rural minority health. In addition to all of this, Jan and her husband Bob are proud parents of 3 sons and 2 daughter-in-laws. A true country girl, she plays guitar and sings in her church choir. For relaxation, Jan plays tennis and runs triathlons. Please welcome Dr. Probst. And Dr. Phelps, will you please come to the podium to present the candidate with an honorary degree? No? Dr. Phelps, it's a personal pleasure and honor to introduce our candidate for the honorary degree of Doctor of Humane Letters.
Yes. The highest degree A.T. Still University of Health Science may confer is an honorary doctoral degree in recognition of superior commitment to the osteopathic medical profession and for service to healthcare, medical education, scientific research, community service, and leadership in political or educational administration. Dr. Janice Probst, upon the recommendation of the faculty, interim dean, and senior vice president of academic affairs, and with the authority vested in me by the Board of Trustees, I hereby confer on you the degree, Doctor of Humane Letters, with all the rights, honors, privileges, and responsibilities pertaining thereto. Congratulations. It's an honor.
I'm sorry, you're probably wondering, why did they let this woman out? She can't even get to the podium, seriously. But let me begin by thanking our president and our dean. As you can see, I'm a little bit overwhelmed by this honor. This is quite, I'm humiliated and delighted, or no, humbled, not humiliated. I'm sorry, I have notes, and if I actually come back to myself, I'll try to read from them. And I have my, at this point, I'm almost ready to throw them out. I do promise, however, that I will not talk too terribly long, but I will talk, this is an alarming thing, I will talk with a certain amount of passion. This is a sermon because I'm used to giving research talks. I'm not used to being asked my opinion, probably because people are afraid I would give it. But I assure you that despite the fact that this will be a sermon, since y'all have already donated, we will not be passing the plate after I'm done. And so, what am I going to talk about? Well, I will start out with what every graduation speaker starts out with, and every conference plenary speaker, and pretty much every speaker everywhere who says, we are in a time of unprecedented change. But this time I think it might be real, because we have 3 things that I want to talk about today, about a confluence of policy trends, demographic trends, and what I'm hoping you as graduates can do when you take your A.T. Still degrees and return to your communities. So my presentation has 3 themes. There's the good news, there's what I call the unfinished work, because that's so much kinder than the bad news, and then there's what I'm going to give you as a solution viewpoint, since I have to be moral and uplifting, and my solution viewpoint is sideways. So first, the good news. This is the first time in U.S. history that we actually seriously seem to be on the verge of deciding that health care for everyone is in fact an appropriate goal. There is a possibility that we will have some form of universal health coverage. We don't know what it's going to be. We are still debating the details. Do we require everyone to buy private insurance? Do we let Medicaid serve this purpose? Do we turn Medicaid over to private insurers? Does meaningful use mean anything? And what are ACOs? And by the way, do they work in rural? So there's a lot of questions that we haven't answered yet. And there's still a rear guard trying to take us back to the 1950s because, you know, healthcare, after all, should be bought and only the rich should have it. But total recall of the Accountable Care Act is going to be a non-starter. There are too many people already starting to benefit from what has happened as a result of healthcare financing reform. Many states have already signed on to Medicaid expansion. So you, as graduates, will, I sincerely hope, live in a world where you can make a profit without having to say, let's get rid of all the low-paid patients. You can have money and mission, which this is wonderful. It doesn't get any better in the field of taking care of primary care folks, in the field of taking care of people who really need us, than knowing that we have the money and the mission and we can get stuff done. You guys can focus on the processes that you've learned here at AT Still without having to worry, we hope, in the future, so much about where the money's going to come from to implement these processes. Because that's the good news. We may be moving into a more generous healthcare environment. Then there's another thing that we have to think about, which I call either the bad news or the work you still have to do. By 2042, and this is a census estimate, whites will be the minority in the US. White children currently represent fewer than half of all babies born, which is an indication of the way the face of America is changing. Literally, the face of America is changing. Why might this be challenging? Because nearly 50 years, I'm going to say that again, nearly 50 years after the passage of the 1965 civil rights legislation, the U.S. has failed to become a post-racial society. Now, I was a child of the 60s and early 70s and marched, and the world was going to be wonderful by the time I was this old. And unfortunately, it really truly isn't quite that wonderful. Hispanic and African American populations are twice as likely as white groups to live in poverty, with all that that entails for their health, their expectations, and their children, particularly their children. A far greater proportion of non-white than white children live in economically deprived neighborhoods with inferior schools. I live in a state where the state constitution promises only, and I quote, a minimally adequate education. Take that into the 21st century with you. Okay, in consequence, those children, minority children, American Indian children, will be less likely to finish high school, less likely to obtain a college education. What is that going to mean for their prospects? The obesity epidemic? Where does obesity shop? It doesn't shop at Whole Foods. Obesity shops at Walmart. So there is a lot going on by the way our minority populations are currently situated. And this is not their problem alone, if you will. Income and resource disparities are bad not only for the folks who happen to be poor, they affect everyone, the performance of the nation as a whole. Forbes magazine, which I don't consider your basic left-wing rag, recently noted that, quote, the growing disparity in wealth made the Great Recession worse and the recovery weaker than ever. We are hurting ourselves. Steve Murdoch of Rice, who is a former director of the Census Bureau and a great speaker, once he like piles gazillions of numbers on you until you all of a sudden your eyes open, has noted that our continuing failure as a nation to provide educational and economic justice to minority populations will cripple the U.S. economically over the next 40 years. We can barely compete in the world market for science and technology now. What will happen if we systematically undervalue our youth of color and our persons of color. Like I say, I live in a state where a lawsuit to provide for equal education in rural schools that was filed in 1993 has not yet been resolved. Just a thought there. So how does this, she's like, oh my God, that woman, where is she coming from? How does this affect us? We're healthcare leaders. It influences the patients you care for. Social justice affects your patient populations and the resources you have to care for them. Medicaid. Medicaid's your biggest reimburser, right? Just really makes you happy there. Medicaid is a major insurer for Hispanic and African American persons under age 65. 30% of these populations are Medicaid recipients. If I were an insurer selling that as a product, I'd say that's great market penetration. So how well are your organizations reimbursed for Medicaid? Now, let's do a thought experiment. What if Medicaid were labeled Medigold and only white people got it? If whites rather than minorities were the Medicaid demographic, would the planned response to Medicaid expansion under the Affordable Care Act be different? Factoid. You can tell I come from the South. The 7 states with the highest African American populations in the US, Mississippi, Louisiana, Georgia, Maryland, South Carolina, Alabama, North Carolina, have all rejected Medicaid expansion. So is Texas, which is tied with California in having the 2nd highest proportion of Hispanic residents. Now, I do concede, because I'm an academic and I'm used to seeing both sides, that there may be legitimate financial or philosophical reasons for saying that if we expand health care, if we expand health insurance, that Medicaid is not the appropriate vehicle. But it is an interesting coincidence if you look at who is chosen to expand and who is not. So what can we do? I don't expect you to be out there marching. We don't expect you to end racism and classism or change the policy in your state overnight. But you guys in the front, just like carefully sit it. They've got you nicely spaced so I can aim right at you. Your guys are poised to become the thought leaders if you are not there already. You can evaluate proposed policies, and with the skills you've learned here, you can evaluate them thoughtfully from a perspective of social justice. Do the things that are being proposed represent true fairness? And you can communicate your opinion. I'm a state government employee. This is the first time I've been allowed to express my true opinions in my entire life, but I'm out of state. But you can work with your communities for appropriate funding of key infrastructure institutions, which is not just healthcare, it's schools. It's all the social determinants of health. You can ensure that your organizations, you can provide that little pocket of sanity, don't regard some groups of people as less important than other groups of people. Which brings to my bang-up conclusion. I know that really all that graduates want for the speaker to do is sit down so that they can get their degree. So what is my bang-up conclusion? And it is that the root of all evil is us versus them thinking. We're the good guys. They bite. Public health and the notion of a public at all depends on a large group of vaguely similar persons who decide that things should be done for the common good. This is sort of a Jeffersonian ideal. But when you have disparities, whether they're based on race, income, age, or ability, these take away our commonality. They separate us into us and them. In healthcare, this leads to GOMERs. Do we have physicians who know what that acronym means? GOMERs, get out of my emergency room. And lots of other unflattering terms that I put under the heading of those people. Those people can be your patients or some of your patients. And if you're in high enough management, those people might even be some of the lower level people in your own organization. It's one of my guiding principles that anyone who says the words those people gets fired immediately. There are no those people. There's only us. And I have an example, and this is where I almost will go off on a rant, but I'll try to pull myself back. I I was presenting at a small research meeting. I've done some research that actually showed up in Health Affairs, examining what happens among middle-aged people, 45 to 64, if they aren't insured. If you go back and if you track them, how many of them are likely to die? Well, as it turns out, the uninsured people are more likely to die than people who have insurance, and that holds true even after you do the standard scientific thing of controlling for race, sex, level of disability, income, let's see, what else have I got? Multiple comorbidities. When you control for everything, having financial access to care actually does make a difference. So I presented these data, and another research person who is a full professor at a school of public health, but I won't give his name because I should, but I won't, said, wouldn't those people just have died anyway? Wouldn't those people just have died anyway? With remarkable restraint, I did not leap from the podium and throttle him, but I was tempted. But when did it become the province of public health to decide that some causes of death get addressed and some don't? Those people, TB has the same demographic profile as lack of health insurance, and if TB were killing as many people as being uninsured does, we would have task forces everywhere to deal with that problem. We don't. People who are uninsured die slowly and obscurely. But at any rate, that is the term, those people. Wouldn't those people just have died? And at our level, and by our level, I mean graduates, those of us who have advanced degrees, it is really easy to fall in us versus them thinking. I am constantly exposed to researchers yammering on about the need to recruit subjects. Hello, they're people, so that they, the hospitals and the researchers, the us, who know so well, can meet their research or accreditation goals. Anytime you get a bunch of highly educated folks together, it is really difficult not to feel like we know so much better than the patients, so much better than the public, so much better than everybody because we're so cool. So, we are. How do you get away from the us versus them thinking, short of firing everybody? I don't have a cure, but I have an angle. And this is where, as I told somebody, this is where I tell you, I want you to get horizontal. One can conceptualize organizations and relationships between organizations and those they serve as either vertical or horizontal. Okay, got that? Vertical, up and down, horizontal, sideways. Just like the fancy name, when you are in a vertical organization, the people at the top decide we should do something. We should engage patients, and here's what we're going to do to engage them. And then we go out and we try to fetch them in. And when they don't come in, we do studies to figure out why they aren't doing what we want, because we're trying to look down at them. But we really do need to think horizontally, to look at what is going on. What do people want? What gets them to work together? And how do we create win-wins? Now, I have actually an example. Now, I actually gave Miss Judy my cell phone so I didn't lose it, but I was going to hold my cell phone up. I have an application on my cell phone that's called INRIX. Anybody have INRIX? Okay, this app tracks where I am at every moment. And as I move, it tracks how fast I'm going. Okay, this is like total privacy invasion, right? Oh my God, anyone with HIPAA who's responsible for or likes HIPAA is now having is now having a stroke. Oh, dreadful, they're following me around. But here's the deal. When you got a whole bunch of people who are willing to let their speeds be tracked, because you got to figure it's when I'm sitting at my desk and it was in my car, you can all of a sudden have real-time traffic reporting. When I first wrote this talk, got my little app out. There were 2,000 INRIX users in Columbia, South Carolina. And because of that, I could see all the traffic patterns on all the major roads. So like if I actually remember to plop on INRIX before I get in my car to commute home, I can see that there's been a traffic accident at Malfunction Junction. And I'm beginning to think that every city has a malfunction junction, but I can see if there's a traffic incident. There's actually a little thing where I can contribute to the community by verifying that incident. although I've never done that because I figured then I would get killed because I'd be texting and driving. But they haven't thought that part through. But there are numerous examples of horizontal, where you get people together and you get more than you started with. Another one I love, I'm not a birder, but there's an app called eBirds run by Cornell, where they managed, after they went down and got horizontal, to get birders all over the world to contribute obscure data that bird people and bird scientists want. They have millions and millions of participants. Now, imagine if we were doing that for diabetes. I know somebody's going to scream HEPA right now, but we can. There's stuff out there somewhere back in your home where you practice. There is a 16-year-old who can write an app that will do that. But we aren't going to find it if we're looking down at those people. We're only going to find it if we're really out and talking to them. It's hard. It is hard to take time and to actually sort of wander around like a hidden person, finding out what people are thinking, trying to engage, trying to ask people humbly to contribute to your mission. This is not easy, but I keep thinking when I look at INRICS and when I look at eBirds that there is something we can do in health if we could start thinking more horizontally. We could get a lot more out of the ideas our employees have, our patients have, our communities have. So that's the end of my talk. That's my bottom message, which is, even though you are attaining really an educational pinnacle that very few people do, please try not to think vertically about how wonderful you are, although of course you are, and you do get to be wonderful for your families today, but to try to think horizontally about how we can make things better for all.